Today I will be presenting on systemic lupus erythematosus, otherwise known as SLE or just lupus for short. Now, a brief introduction. Lupus is a chronic autoimmune disease that affects multiple organ systems. Current statistics indicate that it is more likely to occur in women. The Center for Disease Control and Prevention estimates that in the United States alone, 204,000 people have been diagnosed with lupus. Of those 204,000 people, 184,000 are female, the remaining 20,000 are male. Current treatment for lupus is centralized around symptom management. There are currently treatments involving immunosuppressants, corticosteroids, and B lymphocyte stimulators. Some background on what lupus is. Lupus is classified as a systemic autoimmune disease. It is systemic because it involves multiple organ systems, and it is considered an autoimmune disease because it ultimately results from the unregulated innate and adaptive immune responses. Current research has suggested that lupus is more common in women due to a mutation on the X chromosome, which is why we see a 9-to-1 ratio in the prevalence of lupus in the diagnosed patients, because that mutation on the X chromosome is seen in women. Hello, today I will be presenting on systemic lupus erythematosus, otherwise known as SLE or just lupus. Lupus is a chronic autoimmune disease that affects multiple organ systems. Statistics indicate that it is more likely to occur in women. The Center for Disease Control and Prevention currently estimates that 204,000 people have been diagnosed with lupus. Of those 204,000 people, 184,000 are females, the remaining 20,000 are males. Current treatment is centralized around pain management and symptom management. Immunosuppressants, corticosteroids, and B lymphocyte stimulators are cited to assist with managing symptoms and pain. For background on SLE, it is classified as a systemic autoimmune disease. It is systemic because it covers multiple organ systems, and it is an autoimmune disease because it results from the unregulated activation of innate and adaptive immune responses. Now, current research has actually indicated that lupus is more common in women due to a mutation on the X chromosome, and because women have two X chromosomes, it makes sense that they are more likely to have the disease. Now, there are currently biological causes for lupus that have been hypothesized in previous research. One study tested patients diagnosed with lupus and found that there was a presence of the type 1 interferon, shortened to IFN. IFN can activate lymphocytes, dendritic cells, and those NK cells that result in a breakdown of the autoimmune tolerance. Another study indicated that the TLR7 mutation can cause the protein to become more sensitive to guanosine, which ultimately results in extended B cell lifetime. Now, an extended B cell lifetime is problematic because B cells contribute to producing those antibodies that are responsible for the autoimmune attacks. And one final study found that there are lupus flare-ups more frequently during pregnancy, which is a time when estrogen is high, and that there is remission following menopause, which is when estrogen is lower. So the study suggested that the sex hormones are regulators or activators of lupus. Now, patients who are noted to have lupus usually have symptoms between 20 and 40 years of age. Lupus is noted to occur more in African American and Hispanic women, and in general, lupus occurs in men less than women. There's an estimated difference of a 9-to-1 ratio. Moving on to the symptoms of lupus, these include fatigue, muscle pain, joint pain, arthritis, kidney dysfunction, and skin rashes. There's also a butterfly rash that is common. It's usually found across the face and nose, and it resembles the shape of a butterfly, hence the name. As for the pathogenesis of development, the autoantibodies produced can affect the following: DNA and histones, clotting factors, red blood cells, platelets, and leukocytes. As a result of the activation of immune complexes, this triggers the complement system, which ultimately results in a cascade of events. First, there's the production of C3A and C5A, which causes vasculitis and glomerulonephritis. And eventually, these neutrophils attach to vascular endothelium, which results in a decreased amount of neutrophils in the bloodstream. And this ultimately leads to tissue damage, which is characteristic of most systemic autoimmune diseases, because this tissue damage is what causes the organs to start breaking down, unfortunately. Now, diagnosing lupus involves a series of tests. It can be done with immunofluorescence staining. There is actually a characteristic nuclear staining pattern for lupus. And then there's also blood testing, which can be performed at hospitals or clinics or wherever nurses or phlebotomists are available to draw blood. The blood is then sent out to a testing facility. For instance, LabCorp is a pretty major testing facility in the United States. For those of you who are interested, if you go to this link here, which I will actually go to right now, really quickly, you'll be taken to the LabCorp test menu site. And here you can type in whatever test you want. But for the purposes of this presentation, we will be searching lupus. And if you guys want to follow along, this is really an interesting site for those interested in healthcare, just because it will show you what the tests will be looking for in regards to sensitivities, the turnaround time for results, in addition to the specimen requirements, which is super important because some of these tests have to be collected in specific tubes. In this case, this lupus anticoagulant comprehensive test has to be collected in the sodium citrate tube, which is blue, and it has to be spun down and frozen. So here's some more information on that, storage information, and then reasons that the sample may be rejected, such as quantity not being sufficient, QNS, and then finally details about the test and what it's used for. Now, interestingly enough, although the test name is the Lupus Anticoagulant Comprehensive, it's not the sole test used for determining markers for lupus. Essentially, there are a few other tests that doctors will use. There are even tests that can result the levels of C3A and C5A. Those can also be found on this website as well. So if you're interested, I highly encourage you to take a look. It is all very, very interesting. And then going back to the presentation, right here in this picture, you can see those blue sodium citrate tubes I was referencing earlier. I actually had a coworker of mine take the picture, so credits to him. And so once lupus has been diagnosed, doctors and healthcare providers will evaluate the patient and form a treatment plan. Currently, there is no current cure for lupus, but treatment is manageable. Treatment management is really critical. You want to get ahead of the pain and not chase it, basically. So certain things that are cited to help with lupus pain are anti-inflammatory drugs and actually anti-malarials because they are able to treat that fatigue, joint pain, and skin rashes that are symptoms of SLE. In addition, immunosuppressants have been noted to assist with curbing an overreactive immune system, and these can be delivered orally or via infusion. And then last but not least, we have our works cited. Thank you guys so much for listening to this presentation, and I hope you guys all enjoy your holidays.